The following program is sponsored by the Medicine Center Pharmacies.
Good morning. Welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White, and we're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Chemthorne Motors, and, of course, our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist, and our very special guest, Dr. Heather Minto from Akron Children's Hospital. Thank you for joining us this morning. Welcome to the show.
Good morning. Thank you for having me.
Allergies can affect anyone, regardless of age, gender, race, or socioeconomic status. However, allergies are more common in children and are often caused when the immune system reacts to a specific allergen that has been inhaled, touched, or eaten. Among the most common health problems, more than 50 million people are affected with asthma, seasonal hay fever, or other allergy-related conditions each year. Today we're going to talk about allergies, detection, and treatment. I'd like to remind our listeners today that our program is available on our podcast, which can be downloaded from the App Store on your mobile phone. All you have to do is look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime and anywhere you go. If you have any questions today during our program, you are invited to post them up on our live Facebook feed, or you can give us a call here at the station at 330-450-1480.
So, Dr. Minto, can you tell us a little bit about yourself and what led you to enter the field of allergy and immunology?
Sure. So I'm an allergist, and I currently work at Akron Children's Hospital. I see both children and some adults. And growing up, I grew up in upstate New York, and I was always very fascinated with medicine, with all facets of it, which led me to pursue becoming a doctor. And then when I was doing my pediatrics residency, I actually got diagnosed with asthma myself as an adult. And doing my rotation within the allergy immunology department, I got more interested in the other types of allergic diseases, which led me to pursue becoming an allergist.
How long did it take you from the beginning of your undergrad to what you're into, what you're doing today?
Yeah, so allergy is unique in that you can get into it either through pediatrics, internal medicine, or a specialty called med-peds. So for those people, they have an extra year. So for me, I did 4 years of undergrad, 4 years of medical school, 3 years of pediatrics residency, and then 2 years of allergy fellowship.
Wow, it's a long journey.
Yes.
Okay, so what is an allergy?
Yeah, so an allergy is a chronic condition involving an abnormal reaction to something that's ordinarily harmless, and that substance is what we call an allergen. And it involves an immune response where your body basically sees that allergen as an invader, and it starts a chain reaction leading to the production of allergic antibodies, which then trigger allergic cells to release chemicals called mediators, which are responsible for all the symptoms.
So why do you think some people develop an allergy to some things and other people don't?
Yeah, so as we're learning more and more, we think it's a complex relationship between an underlying genetic susceptibility and then influence from the environment. And the environment can be both the external environment as well as the individual's internal environment, such as the microbiome or all of the bacteria that live within our GI tract.
Let's say that I can remember my mother had an allergy to ragweed. I don't know what they call it today. It's not the same thing. But let's say that you don't really have an allergy to that flower, that whatever. Can over and over and over and over exposure cause an allergy?
Yes, that's one way. As far as pollen, you definitely have to be exposed for your body to become sensitized to it. So yes, that can happen over time.
So we can actually cause ourselves to get an allergy.
It's a little more complicated than that, okay. But in the right person, exposed to the right environmental conditions over a period of time, yes, their body can decide to become sensitized and make an allergic response to that when they encounter it in the future.
So what can you tell us about common allergies that are in general and whether they are becoming more common, less common? I mean, we have all kinds of medicine, drugs, all kinds of stuff out there in this world now. 60,000 antihistamines on the marketplace, and a lot of them are just the same, but where are we at?
Yeah, so allergy is kind of a broad umbrella, and under that there's a very there's more specific things like hay fever, for example, or seasonal environmental allergies. There's food allergies. There's people that are allergic to certain medicines and drugs and insects. But overall, we do see that the prevalence does tend to be increasing both within the United States and worldwide. The prevalence and how many people affected does depend on what kind of allergy you're talking about. But roughly for hay fever, it's about 8% of the adult population. Food allergy is about 8% of kids. It kind of also varies by how old they are, with about 6% in the 0 to 2 age group and about 9% in the 3 to 5 age group. And then, Over
time, and growing up, hey, we lived on peanut butter. I mean, peanut butter jelly sandwiches, to school, all of that. You can't have any peanut butter in the schools because, there's some amount of children, there are kids that have peanut allergy. Where'd the allergy come from?
That's a good question. It's slightly complicated, and I don't think we fully know the 100% answer to that. But what we have learned, especially with peanut, is we think that some of it might be due to increasing genetic susceptibility underlying that. And then if they have other allergic conditions, like if they have severe eczema, for example, or egg allergy, we do see that increases the risk of them developing peanut allergy in the future. And then what we have seen over time is the longer they avoid it, it also would increase their risk of potentially having peanut allergy. In studies where they actually introduced peanut earlier into the diets of younger infants, that it seemed to be protective in maintaining tolerance as long as they continue to keep it in the diet.
Like building a, what's the word I'm looking for here?
Tolerance?
Tolerance. Yeah. Basically, just if we can catch them in a phase where before they've developed allergy, if they're in that higher risk population, and we can keep it in their diet, it does seem to be something that they can maintain tolerance to over time. Now, there are some people who start out that way, and if they don't keep it consistently in their diet, can then potentially develop allergy, but those are the more higher risk.
Well, I don't think of peanut butter as a baby food. I mean, right? I mean, it's not there, right?
Not commonly in our culture, but in other cultures, such as Israeli culture, they tend to introduce it much earlier, and that's how we, over the last couple of years with all these different studies, have kind of been able to see that. It's been a worldwide effort, and we've been able to compare different populations.
Interesting.
Very interesting. Okay, so what are the ways an allergy can be detected before we go into extensive testing?
Right. So in our field, we rely heavily on history, which is the story that the patients come to us and tell us. And so if they have a history with symptoms that could be consistent, then it sort of alerts us to, well, maybe there is an allergy here. We should explore it more. That's what we usually causes primary care doctors to refer people to allergy specialists when there's a story that is concerning for allergy.
Are we still relying on the skin test?
So there are a lot of different testing options, and it kind of depends on what kind of allergy we're thinking of. But yes, skin testing is very helpful, especially for food and environmental allergies to things like dust mites, dogs, cats. That's the traditional skin prick testing that most people are more familiar with. There's another type of skin testing which is called patch testing that we use for people who have concern for a contact skin allergy, like to nickel or certain chemicals.
So how do we determine, we talked about testing here a second ago, but how do we determine how severe the allergy is?
Right. So severity kind of depends a little bit on the definition of severity, and it also depends on what kind of allergy we're talking about. So in terms of environmental allergies, severity is usually how badly does it affect the patient? How is their quality of life affected? How many medicines do they need to take to be able to function in their job in school? For food allergy, severity can be what kind of reaction did they have in the past. If they had a more severe reaction called anaphylaxis, then we do think that they may be at an increased risk of having that type of reaction again, which would be a more severe allergy. Obviously, the ones with the potential to have life-threatening outcomes, such as food allergy, bee sting allergy in some individuals, those tend to be a little bit more severe than environmental allergies, which usually are not life-threatening.
All right, you mentioned food allergies a little bit ago, and I'm kind of excited to talk about food allergies because it's something that I don't always think that, in my opinion, people realize what they're experiencing could be a food allergy or a delayed food allergy. I don't know if that's still an appropriate term or not, but how about you give us maybe an idea of what some of the top food allergens are and what the most common allergies to those would be?
Right. So for classic IgE-mediated food allergy, which is what most people think of when they think about food allergy, that's the one where you could potentially have the severe allergic reaction called anaphylaxis, and those individuals would need to have injectable epinephrine or EpiPens. The top 8 most common allergens are cow's milk, eggs, fish, peanuts, shellfish such as like shrimp and crab, soy, and other tree nuts, and wheat.
Okay. So, excuse me. What are some of the signs that you might see in a child that can indicate it is a food allergy? Now, you mentioned anaphylaxis, so if you're all short of breath and can't breathe or swollen up, that's obvious probably, but I'm sure there's others.
Yeah, anaphylaxis doesn't tend to be a subtle thing, but food allergy in the classic sense is food-specific and reproducible, meaning that you get symptoms when after you eat the food, and usually, unless you have multiple food allergies only with that food, it would be unlikely for it to occur outside of having ingested the food. Typically, it can have an onset within minutes to 2 hours of eating the food, and symptoms are consistent with what people normally think of an allergic reaction. So hives, feeling itchy, especially itchy mouth, itchy throat, swelling, feeling nauseous and puking, coughing, sneezing. Obviously, more severe symptoms such as wheezing or feeling dizzy or passing out would be more consistent with a more severe allergic reaction.
Interesting.
Okay, our first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercom, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center Pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on MedShopRx.com.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking with Dr. Heather Minto, allergist from Akron Children's Hospital. Have a question, give us a call at 330-450-1480. We'll post your question on our live Facebook feed.
Okay, before the break, we started to talk about some food allergies, and you gave us some symptoms of what could be a result. Since we're talking primarily about kids, what is the link between when a baby is introduced to a food and possibly exhibiting a food allergy?
Right. So we've been learning more recently about that. And with regards to the timing and selection of specific complementary foods or solid foods, many studies continue to suggest that prolonged avoidance of solids or specific allergens, such as like peanut, for example, is not protective. We thought it used to be. But we're learning that that doesn't seem to be 100% correct anymore. And prolonged avoidance might actually be a risk factor with regards to allergy. Again, it depends on the individual's underlying genetic background and environmental exposures.
Okay, we mentioned peanuts a couple times, and I think peanuts are probably at the forefront anymore since many of us grew up on peanut butter sandwiches, and now all of a sudden it's like, keep peanuts out of the schools. Or maybe it's just, sometimes I wonder when we get the chance to talk to an expert like yourself that maybe we're just better educated, more aware of what's going on in this environment, and maybe that's why we know more people have an allergy to peanuts. I don't know which it is, but maybe it's a little of both.
And what is the percentage of the population that has a peanut allergy? Is it very small, or is it larger?
It depends on the age group. Peanut allergy does tend to be one of the more common food allergies, definitely more common in children and also in adults compared to the other top major allergens that we talked about. Peanut has been associated with more severe reactions, and so for those two reasons, I think that's why a lot of the research has been devoted to peanuts, and we just know more about peanuts than some of the other types of food allergy.
Is there a particular chemical or something in peanuts that is a common element? I mean, okay, is it all peanuts, or is it cashews, or is it, Right,
so for peanuts, when you think about an allergen like peanut, there are many different parts of the peanut. So there are fat components of the peanut that help where they're stored. There's an outer coating or a seed component. For peanut, we've named them all, and we give them fancy scientific names. There's actually 8 different ones that we currently know about. We know that numbers 1 and 2 are more associated with food allergy and anaphylaxis, whereas number 8 is more closely related to environmental pollens, such as what is found in birch trees, for example. And people who are more highly sensitized to that number 8 one have more itchy mouth, and we think that one is less severe and less likely to have that anaphylactic type reaction than if you were sensitized to parts number 1 or 2.
So what do we have in peanut butter? I know they don't just take peanuts and grind them up and put them in a jar. What do they put with it?
Well, the best type of peanut butter is actually just that ground peanuts that are put in a jar. But the processed ones that we see typically also contain sugar, some oils, and some preservatives.
Okay, so What is, given your experience, what do you recommend to new parents these days? Do you recommend they introduce peanuts or peanut butter at some point as the child is growing up, or what's the best practice, maybe?
Yeah, and because of all the new research that's come out, we actually got some updated guidelines in 2017 as far as recommendations regarding that. So it kind of depends on what your risk of developing peanut allergy would be. So infants who don't have any eczema or any history of other food allergies or a significant family history of allergy are probably less likely. They would be considered a lower risk. And so we would recommend introducing peanut-containing foods when it's age appropriate. Generally, we're recommending around 6 months for kids who are lower risk. For kids who are higher risk, such as those who have severe eczema or already diagnosed egg allergy, we would want to try to get peanut into those kids a little bit earlier, generally between 4 and 6 months, but we would recommend evaluation with an allergy specialist prior to doing that.
Okay, we hear that peanuts are nutritious. Okay.
Yes.
And the whole world's living on peanuts. I mean, really, I really love peanut butter. I just do.
It's a very good nutritional component. It's got high proteins. It's got good fats. Yes.
So, okay. Oh, we got a food allergy. Is it wise to treat the food allergy and eat the food, or is it unwise? And when I say treat it, talking about antihistamines, obviously, and some things along that line. And as a kind of a corollary here, in my time as a pharmacist, I have seen physicians in a couple of cases where maybe the individual's allergic to like an antibiotic, but for some specific reason they want the individual to take that antibiotic. So they give them like a Benadryl along with the antibiotic. Is it wise to do that? And I'm not making a judgment on the other guys. I'm talking about allergies,
Well, for food allergy, if you've been diagnosed with a classic food allergy, so that's one that's allergic antibody mediated, strict avoidance is how you manage that. You also have to be prepared to treat a severe allergic reaction such as anaphylaxis, because that could happen if you eat if you eat that allergen. And so those people would have to have an EpiPen or injectable epinephrine to keep them safe. Antihistamines could be used for milder reactions, but it's not going to be life-saving, and anaphylaxis can be life-threatening. So we say no, just avoid it.
Okay, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White, from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Spring is in the air, and it's the perfect time to shop Northeast Ohio's largest auto mall with one click at KimThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz. Something for everyone's price range. And KimThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? It's never a problem. We have a huge selection of pre-owned vehicles to choose from. The Kim Thorne family name's one you know and trust that's been committed to our community for over 80 years. Shop KimThorne.com.
We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on MedShopRx.com.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at StudioArtsandGlass.com. That's StudioArtsandGlass.com.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about allergies in children with Dr. Heather Minto from Akron Children's Hospital. We've got a lot more to cover this morning, so let's get back to the show.
All right, well, we've been talking about food allergies and other exposure allergies, and how about this, just for good measure, for listeners just joining us after the news break, how about you just tell us where you're from and what your specialty is, and then we can go on into our second half of our program.
Sure, yeah. So I'm an allergist at Akron Children's Hospital. I primarily practice in Akron proper, but I do see patients one day a week on Fridays in our North Canton satellite office.
Oh, okay. Now, where is your office in North Canton?
It's we're currently working out of an Altman building on Whipple Avenue. I think it's the intersection of Whipple and Dressler.
Okay. Gotcha. No, that's great to know. Mm-hmm. Okay, we got a food allergy to whatever. We just avoid eating the food. But like I said earlier, I like peanut butter. I'm not allergic to it, but what else can we do to prevent an allergic reaction?
Well, at this moment in time, our current approach in management is primarily avoidance and being prepared to treat a severe reaction if, for instance, there's an accidental exposure, ingestion, or a cross reaction where the food you're eating is contaminated either knowingly or unknowingly by the food that you're allergic to. There are currently several options that are still in research as far as hopefully helping with management from trying to modulate the immune response. But as of right now, that's all still in research.
So it's avoidance.
Yep.
Okay.
And making sure they have EpiPens.
I guess, back to peanut butter, I guess some of the allergic reactions are really quite dramatic. So I've heard. EpiPen turns it or not?
Yes. So injectable epinephrine is what would be life-saving if you had a life-threatening allergic reaction, which we call anaphylaxis, and that's a more severe reaction. Epinephrine works to help relax your airways, so people who have anaphylaxis can have tightening of their airways, leading to difficulty breathing, wheezing. So epinephrine will help relax that. Epinephrine also helps close your blood vessels to support your blood pressure. So if you're having a severe allergic reaction, your blood vessels can get kind of leaky. And when that happens, your body has trouble sometimes supporting your blood pressure, and so you can pass out, which that would be dangerous if you're not getting enough blood flow to your brain to circulate all the important stuff. So epinephrine helps support that as well. That's what makes it different than an antihistamine such as Benadryl, and that's why it's important for patients who have food allergy to have it with them at all times.
Okay, so what's a parent do? Let's say we don't have an EpiPen.
Right. So if there's a concern for food allergy because there's been a reaction or they've noticed symptoms when their child eats that food, then they should talk to their primary care doctor about either getting a referral or seeing an allergist where further evaluation can take place. If they present to their primary care doctor and there's a history that's consistent with a lot of concern for that, it would not be unreasonable for the primary care doctor to prescribe the family injectable epinephrine with a device such as an EpiPen or a Adrenaclick or an AubiQ until they can get in to see an allergist just in case.
So where I was going there is, let's say it's a first-time effect, okay? We don't have an EpiPen. What can we do? CPR? What do we do?
Call 911. If there's a concern for a severe anaphylactic reaction, call 911. Emergency medical providers will have epinephrine that they can use to treat as needed, and then they'll take you to the emergency department to be monitored. And often patients would be discharged with an EpiPen and receive the teaching that goes along with it then.
Where are we at on the current pricing on the EpiPen? I know there was a big controversy about what they were doing with the pricing, and I'm not, haven't worked in a pharmacy in a little while, so I'm not familiar with exactly where the numbers are.
It's kind of scary, but fortunately it appears that there are ways that there are some manufacturer programs that are out there that are helpful. So
for a 100-year-old drug, I mean, it's pretty amazing that it still has so much of value,
Yes, and the drug is the same regardless of the device. It's the thing that is branded and copyrighted is the delivery device.
Yeah. Well, and the thought of, okay, here's a vial of adrenaline, okay, stick a needle in it, okay, pull it up, okay, stick it, give it to the affected individual. I mean, that's really kind of scary. But what do you do, I guess? Huh?
The auto-injectors are nice in that regard because the dose is already managed, so you don't have to worry about drying up a dose or making sure that you have the right dose, you're not overdosing or underdosing. It's all right there, and they're easy to use. They require very minimal training, and so that's really, really nice.
How common is it for a child to outgrow a food allergy?
It depends on what they're allergic to, and it's more common for certain food allergies as opposed to others. So the more common younger childhood food allergies, such as milk and egg, are commonly outgrown, whereas peanut, and then in the adults and older children, fish and shellfish are less commonly outgrown.
What about, it's spring, I think. So I don't know if we're going to have any more snow. I don't mean to swear on the air. But seasonal allergies, I'm driving home last night and I look up and the trees are budding on my little neighborhood boulevard. So I'm thinking, oh boy, it's time for maybe allergy recommendations. What do we do? What are typical seasonal allergy symptoms for a child, or I suppose adults could maybe be similar? And what's your approach to help a patient like that for when they've never experienced it before? Right.
So seasonal allergy symptoms are usually things like nasal congestion, so feeling really stuffed up, runny nose, red, watery, itchy eyes, sneezing. Sometimes people will notice that they seem to be a little bit hoarse or have a sore throat, most likely from postnasal drip. Those type of things are clues that they could have allergies. Some people will describe it as a cold that never goes away.
I'm going to ask you a loaded question because you touched on it slightly earlier, and I know we're not really talking about prescription allergy stuff today, but many people have this premonition that if they have drainage and congestion, that they need an antibiotic. So why don't we tell everybody about how an antibiotic will or will not affect their seasonal allergy issues?
Right, so antibiotics are helpful in fighting bacterial infections. And so people who have allergies tend to have more congestion in their nose sinuses, which can impair drainage. So if the mucus can't get out and it collects in there in a nice warm, wet, and sticky environment, that will encourage bacteria to grow. And so some people can end up with a sinus infection, which would require treatment with antibiotics. But for most people that just have the postnasal drip and the clear drainage and sneezing, antibiotics not really going to work unless you have a bacteria infection.
Okay. What are some good ways to reduce exposure to common seasonal allergens?
Right. So if you know that it's a high pollen day and you're allergic to it, sometimes taking your allergy medicine like an antihistamine before you go outside can be helpful. Making sure you've done your nose antihistamine or your nose steroid prior to doing that can be helpful. Limiting your exposure. If we know it's a high allergy day, that may not be the best day to mow the lawn or rake the leaves. And people who have allergies to grass and weeds probably should not try to do those chores if possible. Another good way is to drive with the car windows up, using the air conditioner and setting it to recirculate as opposed to pulling in air from the outside.
I've noticed too a lot of weather apps or weather reports often include pollen and environmental air quality in their reports now, so that could be a tool too, I assume.
Yes, that can be very helpful for patients because both of those things can definitely trigger the symptoms that are associated with allergies.
What about, you touched on something which I hadn't thought about in a while, but it's probably, if you suffer from hay fever or a seasonal allergy, is it not more common and more effective to take your allergy medication on a daily basis rather than waiting for those symptoms to inflame and trying to deal with them after they're already a problem?
It depends on the type of allergy medication. Some are quicker onset and some are a little bit slower to act and do require sort of that more proactive approach. So I would say for patients who have known seasonal allergies, one of the mainstays of therapy is a nose steroid. And that's a little bit slower to work and works better if taken on a consistent basis, ideally starting prior to the start of the season if you can, just because it does take a little bit longer to work. Other types of allergy medications, such as nose antihistamines or oral antihistamines, they work a little bit faster and they can be used more as an on-demand treatment.
Okay, well, this morning we've been talking a lot about food allergies and different allergens in our environment that can upset our daily quality of life. I wanted to let everybody know before we take our next commercial break here that we do have an accredited non-sterile compounding laboratory in our New Philadelphia pharmacy. And as a result, if you have a special sensitivity to any type of product that could be in your medication, whether it be lactose or any type of dyes or colorings or additives, we can often work with your physician and your patient to compound a solution that will avoid those allergens that could cause you a problem.
Final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercom, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. It's allergy season, and today we're talking with Dr. Heather Minto from Akron Children's Hospital about allergies. Let's get back to the last segment of our show. Okay. We have right now the trees coming out, correct?
Yes.
I guess until the last few years, I never really paid much attention to the fact that there are pollen producers in this seasonal time of the year.
Yep.
So, do you have a list of the worst trees, or are there certain big-time offenders like the oak tree, or?
It kind of depends on where you live in the country, as there's different trees in different parts of the United States. For example, if you live down in certain parts of Texas, there's a cedar tree that's pretty notorious for being a winter pollinator, which is unusual for trees.
Interesting.
But in the Ohio area, our trees pollinate in the springtime, and that's what you're seeing on your cars. And probably the most notorious one of the trees that live in our area is the birch tree.
I got one across the street from my house.
People who are allergic to birch trees can sometimes have problems eating raw fruits and vegetables because there are similar proteins in birch pollen and in those fruits as well, and they can end up with like tingly mouth, tingly lips. Yeah.
Interesting. Okay, so as you age, are you more prone to develop allergies, or not? I guess.
So yes and no. In people who are genetically susceptible, meaning they have a strong family history of allergies, as they grow from an infant into childhood, their risk of developing allergies definitely increases. For pollen allergy, you have to be exposed to the pollens before you can have allergies. And so usually we don't see those develop until between 2, but more commonly it's in later childhood, like 5, 6, even up to 10. And then, as you go into adulthood, you do have some increased risk, but it depends on your risk factors, which the strongest one is usually a genetic susceptibility. Okay,
we got an allergy started early in life. Can we outgrow it?
Depends what it is. Certain food allergies, yes. Allergic skin, like eczema, doesn't necessarily fully outgrow, but it can be better so you're not breaking out. Seasonal allergies, less common, although for seasonal allergies and environmental allergies, such as allergies to dust mites, cat, and dogs, we have something called allergy shots, which we can give to patients in a medically supervised way, which can actually reduce their sensitivity to those allergens. And so it looks like they've become tolerant, or kind of looks like they've outgrown it in that regard.
Yeah, it's not in the script, but I'd like to ask you about what can we do in our home? Over the years now, I had an aunt who had severe asthma. She had a precipitron on her furnace. I don't even know what that is anymore. But there's all kinds of air purifiers that are on the marketplace and things along that line. What can we do to fix our home?
kind of depends on what you're allergic to. Air purifiers work the best for allergens that are small, lightweight, and buoyant, because air purifiers clear the air. So if the allergen is not suspended in the air, then it's not really going to be as effective. So those type of allergens are usually the danders, like cat dander, dog dander. So for people who have allergy to cat and dog, where they're not as a severe asthma, filters can be helpful if the animal is going to remain in the home. Other things for animals is keeping them out of your bedroom so that you're not sleeping surrounded by things you're allergic to. Washing the animal frequently can help reduce that. Carpets and upholstered furnitures can hold on to allergens. They're brought in from outside by pets or by tracking them in, and they can kind of hang out on carpets. Sure. Yeah. Dust mites hang out in upholstered furniture as well as mattresses and pillows, so dust mite allergy covers for your mattress and pillow can be helpful in reducing your exposure while sleeping.
You're going to make me want to go home and clean the whole house now. So.
Okay, insect bites. We haven't hit the insect bite thing yet, and stings are very common. Got one myself last year in Yellow Jackets. What do we do about this with bites, stings?
Yeah, so insect bites, less likely to be a true allergy to it. Obviously, there are some caveats to that. The most important thing is to try not to scratch it, because scratching will make a mosquito bite much bigger. If it's very bothersome, sometimes you can try putting an over-the-counter steroid like hydrocortisone on it. That may help, especially with the itch component. Bee stings can be life-threatening in certain individuals. Those individuals usually have whole body symptoms, meaning that when they get stung, they may have some coughing or vomiting or dizziness or feeling like they're going to pass out. Those are the individuals that usually end up in the emergency room. Those are individuals that we need to see because they do need to have injectable epinephrine, and further testing if they show allergy shots to bees actually will reduce their risk of having a life-threatening reaction on subsequent exposure, and that's what's recommended is for those patients to get
for that patient. Wouldn't a raft of allergy shots like Yellow Jackets are different, wasps are different, bees are, am I right on that? Correct,
yeah. So wasps are different than bees, and often people don't know exactly what they were stung by. So there's different testing that we can use both through blood and skin testing to identify what they're allergic to, and then based on that, we use that in their allergy shot.
Very interesting. Well, we are tricking down on time here. How about people who are listening that have more questions about allergies or wonder if something you've touched on today makes them think they need to be seen or talk to their doctor about? Give your recommendation on that and how they can get in touch with you or one of your colleagues at Akron Children's.
Yeah, so anyone who thinks that they may have allergies, the first step would be to talk to their primary care doctor to see what they think. If they need a referral, we're happy to see them. We see at our practice both kids and some adults, and we serve we have satellite offices in multiple locations such as Hudson, North Canton, Mansfield, and Medina, as well as our main office in Akron. There are a couple of websites that are really good. If you go to akronchildrens.org, you can search for allergy, and there's a bunch of videos on common allergy topics. For food allergy, there's a food allergy education and research network, and their website is foodallergy.org. They're an excellent reference and have a lot of really good information for patients with food allergies.
Anything you're excited about real quick in upcoming tech?
Yeah, there are currently a couple of new injectable medications that try to block the specific chemicals that help mediate some of these reactions. There's one currently that just got approved to treat eczema in adults and on the market for kids.
Guess what? We're out of time, and it's been really great. Okay.
Thanks.
Thank you, Dr. Heather Minto from Akron Children's Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and, of course, JD, our technical producer. As always, We thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you again right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.